Having someone by your side as you grow your healthcare business is critical. Here's why. Having a COO or Chief Operating Officer as you grow your healthcare business, whether it be a clinic or a medical practice, is something you really need to consider. One of the things I've realized is that it's hard to do everything. When you have a business, you need to have at least two individuals. One can be technical, one can be more focused on sales, or a better way to approach it is maybe one is outside focused, thinking about the vision of where the business overall can go. And the other person can work on operations, really digging deep into understanding how you're going to deliver the services that the CEO or the outside partner is doing. The reason why you need both is because it's very hard to sell and do functionality at the same time, right? You can't do both because when you're dealing with patients or you're dealing with hiring individuals, or if you're thinking about how you want to expand and get a new office for your practice, those are different skill sets and they take just as much time to do each and every one of them. If you're looking at expanding to a new practice or purchasing a practice, you really need to understand what you're getting yourself into. You need to market, you need to have conversations, meetings. Those take hours and hours on time in order to figure out exactly what direction you want to go in. Likewise, if you're doing operations and you're trying to deliver great, superior services to your patients and your colleagues, you want to make sure you hire the best people. You have to have an ongoing tracking mechanism to understand if you're hiring the right people, how you train these people to make sure they deliver patient care at a high level. You really need to dig deep into understanding all the insides and outs of what it goes into in building out a great team. And so that's why those two functionalities have to be separate. One thing I've seen work well is you have clear delineations. So the person who's delivering the operations, right, they need to understand exactly what their roles and responsibilities are. Yes, there can be communication, there can be ideas tossed on the other side, but ultimately it needs to be the one person. It's their responsibility to ensure that that goes right. So that means having metrics around customer churn. If customers or patients are leaving the practice, you want to make sure that you have a mechanism to track that, and that operating partner needs to be focused on that. So if you have a lot of patients that are leaving the practice, then why is that happening? That's the question the operating manager should handle. They also should understand the operation budget. What are they spending on hiring individuals, right? Are we hiring the right people? You may have a lot of mid-levels, but they may not train specifically for opportunities that you want to go after. So you want to make sure you bring in the right people, and then you want to ongoing train them and evaluate if they're doing the job they need to do well. The third thing the operating partner needs to do is making sure that overall the practice is functioning as it should at a high level. So metrics around, like I said, patient churn, metrics around ensuring that the employees are happy and trained properly, metrics around equipment, making sure you have the right equipment, it's up to date, it's functioning well, that's dealing with technology, making sure you have the latest EMR information, all that. Billing, making sure that's done properly and effectively, making sure they are embedded inside and guiding the technology to where it needs to be. That's very important when you're kind of dealing with these high level functionality when you have an operating partner. Now, what does the visionary partner do, right? Their goal is more outside focus, right? They need to understand trends like where is the healthcare industry going? What new opportunities? Should we get into virtual care services, right? Should we look at expanding into new markets? Should we understand what technology would be best suited for us? Should we understand artificial intelligence and how it can help us generate more patients? That is the goal of the visionary or outside facing partner, right? And if they're focused on that, then the business will grow phenomenally, right? It will continue to grow because they're seeing around corners and doing things that help the business overall grow. But they can't be pulled into the operations side. And sometimes the operations is good for the outside partner to understand, right? Because they need to understand what's working well, what messaging seems to resonate with our current customers, because guarantee that same messaging can resonate with the other customers, the new customers that the outside partner is trying to gather. But when you struggle going back and forth too many times, the operating partner starts lessening their responsibilities, and then the visionary partner starts getting more and more inside their business because they want to solve problems. That's what you do as an entrepreneur. That's what you do as a business person. That's what you do as a healthcare person. You want to help. And sometimes you get dragged in too much into the operating side that the visionary side dies and you're not growing. So you need both. So here's some key things that I've seen that worked well. Number one, you want to make sure you hire right. You got to get the right operating manager involved. Someone that enjoys fulfillment, helping the patients out, making sure they like to be in control of people and making sure they understand how the employees are operating, making sure they can hire and fire, making sure they understand budgeting. That's the role of the operating manager. So you want to hire right. So once that's out the way, next step you want to do is have a standard operating procedure manual. Having something that clearly delineates what the operating manager is responsible for and then what the visionary person is responsible for. And those should never meet. Yes, they can talk. My opinion, have a standard call. You go over all the different components so you can cross talk and communicate so everybody's on the same page, but it really should be delineation of the key tasks. Number two, now you have a clear delineation of those tasks. You want to make sure you have KPIs, key performance indicators, to understand exactly what they're going to be tasked with and verifying how meeting against those targets. For instance, if the operating manager is focused on patient churn, then there should be numbers that they should not go below. If they're looking at those numbers and they start to dip, then questions need to be asked like, why is this dipping? What's happening here? How can we do this better? The visionary partner can absolutely help the operating partner with some of that, but the goal would be to ensure that the operating partner is ultimately responsible for making sure those numbers stay on track. Likewise, when you look at the visionary partner, they need to be focused on new opportunities, new partnerships. They need to be gauged on a weekly, monthly, quarterly basis. Are they meeting those targets? If they're not, we need to find out why. What things are they doing right? What things are they doing wrong? And it's not so much that you're being tasked with these duties and making sure you get things done, but it's really about accountability, because now that someone's responsible for it, then now they're totally focused on that. And once they're focused on their goals, then they can get a lot more done. One of the things is wherever you focus in will expand. And so as their visionary partners focused in on new opportunities, new partnerships, new ways to grow, then guess what? That's going to expand the business and help it grow faster than it ever could. Likewise, if the operating partner is focused on making sure patients are happy, making sure the employees are happy, making sure the technology is up to date, that's going to do better, right? We're going to get better and better at fulfillment, and that's going to help the visionary partner do more with their work. So that's kind of the things that you have to think about as a business owner, but also as a healthcare professional. You also got to think too, the operating partners understand your legal ramifications of what's happening with HIPAA laws, so that if there's any new idea the visionary partner comes up with, the operating partner can say, hold up, let's go talk to a lawyer, or let's understand how to unpack that better and see how that could work. Because ultimately, if the fulfillment gets better, providing better service for your patients, then it's so much easier to partner with more folks, so much easier to expand, it's so much easier to get more patients because you have faith that the operations are doing as they should. And so if you have that unique mix and balance between the two partners, that allows you to grow exponentially with your practice. We've seen this, for example, we have a practice out in Maryland. The doctor is very ambitious, cardiologist, focused on growing his cardiology, but he got into 2 primary care practices and he wants to see them grow. The challenge is he has no time to look at that. He's so busy running his main practice, cardiology, because as you can imagine, that specialty brings in the bulk of the revenue. The primary care practices were opportunities to expand new markets, also get new patients that can drive into his cardiology practice, but because he didn't have an operating partner, those are languishing there. So we were able to help him by bringing on a consultant that can help him with those 2 areas, those 2 practices that can help them get growth again, right? Seeing and tracking what the doctors are doing, making sure they're seeing the right patients, making sure they're targeting all the areas they need to. And now he's starting to see, oh wow, this is why I was losing money this month from this practice, because they didn't have enough patients, or the turnover was too high with their mid-levels, or the billing wasn't done properly. So now that he has data, now he can move a little bit faster on his growth aspirations. Likewise, as you're a medical doctor, if you're medical practice owner, you're a physician group, and you're looking to expand, making sure the operating partner understands that and is really immersed in the day-to-day operations and communicating effectively how we're going to get to the next level with fulfillment. Whereas getting to the next level on growth is really the goal of the visionary partner. So that's how I see things working well when it comes to healthcare, because if you don't have that clear line, then you're not going to see the growth that you want, and you're going to struggle all the time to get to the next level. And that's something you definitely don't want to do. You want to make sure you're continually growing and moving forward in the right direction. So hopefully you like this content. If you do, follow me for more. I have more topics on virtual care health services, as well as how you can think about medical billing and how it can affect you. So check those videos out. So if you like this content, follow me for more.